AM 1220, KHTS, your hometown station. You're listening to Dr. Proctor with me, T. I'm here with you every Thursday from noon to 1, having an informal conversation with the medical community about what's going on in not just the world of medicine or the world of support medicine, but also the idea that we can have conversations that we might not be able to have with a doctor at any time of day or night. The other thing is people, when you go looking on Google and you start searching, there's a great television show that the tagline was, "It's never lupus." Every time we go on the internet and we put in symptoms or you're going to drive yourself crazy. But if you can have at least an educated guess at what might be going on, to be able to call your doctor and say, I feel like we need to have these conversations. That's what Dr. Proctor's all about, a chance to have conversations with the medical community to talk about what's best for our health, our loved ones' health, as the population ages and medical issues might become more of a looming problem in our lives, or we're taking care of loved ones. The more educated we can be, the better versed we are to have conversations with the medical community. It allows us to be our own best advocates. With me today, I have Dr. Michael Farzam. He owns a company called House Call Doctor Los Angeles. You can find him at housecalldoctorla.com. Email him at info@housecalldoctorla.com. And one of the reasons I mentioned his email is because I wanted to, it's January, talking about top reasons people go to the doctors, which would be low back pain, upper respiratory infections and or flu, headaches, and different reasons, anxiety, these are the top issues that people will go to a doctor, but like Dr. Farzam, he'll come to you. The other thing I wanted to talk about are the top embarrassing things that we are often afraid to talk to our doctor about. And one of the issues I wanted to bring up is back in the day when I was young, talking about STDs, there was a huge stigma. We kind of, the pendulum is swinging back again. There was a lot of conversation. It was okay to discuss it. Then it's, I know with my own grown kids, it's like, mom, please stop. I don't want to hear it. It's like, okay, wait, no, these are important conversations. What happened to taking the veil off of embarrassment? But they don't want to hear it. And I know sometimes just making that call, doc, I have this, I have a rash, or it can range from something as potentially devastating as an STD to something as simple as, well, not simple, but something as unexpected for some patients as psoriasis or a skin issue. Do you find that patients that's hard for them to come to you and say help?
I think patients get embarrassed. Obviously, we're humans, so different people get embarrassed for different things. I would say as just a general rule, you really have to be comfortable with your doctor. And so if you don't have that kind of relationship where you're comfortable enough based on the rapport you've had in the past with your doctor to be able to speak out and tell them anything, you really just shouldn't keep information from your doctor. Otherwise, you're doing yourself a disservice of one, being misdiagnosed, or just not getting a proper evaluation.
And it can lead to bad things if you don't deal with it. Besides just discomfort, which is awful. And again, when we talk about low back pain, you're sitting all the time. If you're sitting on your parts and you're uncomfortable, this is a bad thing. But it can lead to some pretty serious health issues.
It can. And the biggest thing I would tell people is that your conversation with your doctor is very personal and private. It's obviously confidential based on HIPAA standards. And it should be unjudged. And so if you have a doctor that you're not comfortable with or feels like they would judge you, that's not the right doctor for you.
Right. I know too that there's a large portion of the population who maybe didn't even have medical care until recently. They might not have a doctor. So it's not something that they should be concerned with. Just find a way, do you ever feel like you have to finesse a patient into, how do you deal with someone who comes in and they're maybe tongue-tied or they just don't know how to do that? What do they teach you that in medical school, or is that a personal thing?
I think that's a personality trait of being able to have an open conversation where you ask them questions and let them open up versus interrupting them or being more direct or seeming like you're in a rush. That helps a lot open the dialogue and let them express themselves, and brings out other issues or other symptoms that you might not otherwise get.
There might be more going on.
Yeah.
Another one I can relate to is through a lifetime of, historically speaking, with people that I know, bad breath. Now, often you might think, that's something you talk to the dentist about, but it's also something you can bring up with your doctor. There's a number of things that can cause not just dental issues, oral issues, but there are other things that could be going on in the body that can cause this, correct?
Yep, definitely. There's probably the most common cause of bad breath is actually just reflux, or what we call heartburn.
Heartburn, good old-fashioned heartburn.
Good old-fashioned heartburn that gives you, burning or discomfort when you have to eat a spicy meal or acidic food, or from too much caffeine or smoking or alcohol. The acid buildup actually tends to travel with gravity and just goes up and actually can affect the breath.
Hurts you and the person you're talking to.
Yeah.
So that's an issue.
So that's one of the many causes.
So digestive
type issues when it relates to acid can cause bad breath, outside of dental issues, which, can contribute to it, but the likelihood of having a rotting tooth is not as actually likely as some of the other medical causes of, postnasal drip or phlegm in the back of the throat. Some people get food pockets stuck in the back of their tonsils. Tonsils are bad.
Tonsils are like those strange little pockets at grandma's purse. You don't know what's in the corner, but man, when it comes out, it's not pretty.
They're there. Yeah.
Do docs take tonsils out anymore?
It still is a common procedure. It really depends on the patient, and it's done a lot in childhood, but it's generally for people who have enlarged tonsils that are either affecting their airway with breathing or snoring, or if you're getting recurrent strep infections, strep throat type of tonsillitis infections, more than five times a year.
Okay, so bad breath can be tonsils. Another one that I think people, it seems they're embarrassed to talk to the doctor about because they think, this isn't really a medical thing. Is excessive sweating.
Sweating is a common complaint we see. It probably is embarrassing. It's probably more socially embarrassing for people in public because, some people sweat through their shirts. They're constantly...
But it's something that you shouldn't be embarrassed to talk to your doctor about. It's a medical thing, and there are things that can be done for that, yes?
There are. There's normal variants of sweating, which is very easily treatable with sometimes prescription, antiperspirants. And then there's actually medical causes for excessive sweating.
And you might want to take a look at that, what's happening. So don't be embarrassed to mention that to your doctor, to say, hey, I have this. And not just the body. I know people who, it's the handshake. I hate to shake hands with someone because I get so nervous that I'm sweating. But there, again, it's something you should go ahead and talk to your doc about. I have something that I've never been a dog person. Never owned a dog, and we now have a dog. We've had him for 4 months, and we went on a trip, got a phone call, the dog's sick. Dog has, a couple of symptoms that I realized, hey, somebody in my household had those same symptoms. And I got to tell you, the idea of calling the doctor and saying, is it possible that the dog and someone in my household could have the same thing? Is that possible that the dog and the person, the human being, could have a similar illness? Because that's mortifying. The idea that the dog's done his business on the linoleum, and now someone's got to call the doctor and say, hey, could I have the same thing the dog has?
There's definitely interspecies type of infections that spread. Probably what you're referring to, intestinal amoeba like Giardia is probably the most common that's spread through cats and dogs. If they have episodes of vomiting or diarrhea, those can definitely spread to humans and cause the same abdominal discomfort and loose stools. Giardia spread through water contact or dirty water contact, which obviously if animals are outdoors, they can lick streams, they can pick it up anywhere.
They pick up anything. Look, that looks like lunch. No, that's bad. Step away from the stuff.
And if you're petting them or kissing them or cleaning up their
business,
then definitely those can.
That's a medical term. I'm helping you out. I see that. But yeah, that is absolutely something that, while wildly embarrassing to be able to ask your doc. Now, the idea that we go through, I feel like we talk about so many things in with reality television and everything but there are still some areas that people are. I didn't realize that you could cross worlds like that. I just figured, the dog would have something and nobody else, that's a dog thing.
Yeah, no, there's a lot of, if you look at, avian flus and a lot of the flu viruses that are the most dangerous or lethal that are out there, they come from chickens and other birds. And if you look at HIV, stemmed originally from apes. And so there's definitely interspecies type of communicable diseases that we can spread.
That's pretty fascinating that's even an issue. Now, as a doctor, I know we've talked about the top reasons that people will go to a doctor and maybe some of the top embarrassing things that you should not be, you should go ahead and discuss with your doctor. Where does the doc go when the doc doesn't feel well? And do you ever find as a doctor, I'll just deal with this myself? Or do you come to a point where you go, all right, now I have to go see the doctor? How does that work for you guys?
I think doctors are hopefully humbled enough to be able to have their own doctor and not care for themselves. I think we get a little complacent and probably address things.
Are you objective?
I try to be objective with myself, although I'd rather not be, and I'd rather leave it to another doctor to take care of. Same way I wouldn't take care of my own family. Because there's emotions involved.
I've always wondered how does that work in the medical field when you guys get sick? Because if you're an auto mechanic, I would think, all right, you know enough about your car that you would take care of it. But that maybe isn't in your best interest either. Or when you don't feel good, and I've never really considered what you guys do.
Yeah, as I said, it's humbling. I think doctors generally make the worst patients because we're just, as a whole, we're more in denial. We probably don't want interventions because we know what they involve or what they entail. But when you're sick, and doctors get sick just as much, and we get the same illnesses, unfortunately.
Now, with the aging society and the idea that we do have more of the baby boomers and some of these issues that we talked about, do you have any predictions or things that you think you're going to see more and more of, in addition to the top things we already discussed that might be coming down the pipeline? Or
I think generally, obviously we do have an aging population. Our medical advances and technologies have gotten so incredible over the last 10, 20 years that we are able to keep people alive longer and healthier. To a certain degree. And so what comes with that as a downside is, as you live longer, just by definition, cancer's risk increases because cancers stem from aging cells.
Right.
And so the cancer rates as a general population statistic will increase as the population ages and gets older. So that is something we've seen, and that's something that we'll continue to see over the course of the next 50 years as people are being kept alive longer that would have had heart attacks and passed away are now being kept alive and very healthy.
And then something else will come, in their lifetime. What are the top things you would like to see your patients do to be their own best advocates for their health? I know it's good for you to see patients, that's what doctors do, but if you had some top suggestions for someone listening to that they could, to stay in optimum health, to have you come to them, House Call Dr. Los Angeles, have you come to them when they need you, but what are some of the top things they could be doing for their best health this year?
I stress prevention as a very high priority for patients when I speak to anyone who's sick or not sick. Some of the simplest things that I stress to people is, hydration. So making sure you're just drinking lots of liquids, at least 8 to 10 glasses of water. Most people don't drink enough water throughout the day.
Now, there's dehydrating liquids too, right? So coffee, tea, maybe not the best.
Caffeinated drinks generally dehydrate you. They make you pee more than you need to, and so that's probably not the best, or an alcohol.
Water's the best thing you could be doing.
Water is the best thing for you. Yeah. Outside of that, I mean, good sleep. So most of the population.
What does that look like, though?
Well, if you can get at least 7 hours of sleep per night is ideal.
7 hours is good. Who are these people that I keep hearing about? Oh yeah, 4 hours. I'm up. I'm gone. I'm productive. Is that really maybe not the best thing, or do you think they're napping? I think they're napping.
I can't speak for everybody, but I think.
But as a general
rule, 6 to 7 hours of sleep per night.
It's restorative. It's regenerative.
It's rejuvenating for the body.
Yeah.
The body needs time to unwind and rest and rebuild for the next day, whether it's mental capacity or physical capacity. So
hydrating, getting adequate rest, which looks like about 7 uninterrupted, if you can, hours. Mm-hmm. What that dreaded planking thing, is that, do I have to revisit the plank, Dr. Farzam?
I think outside of doing core stretching and exercises, even a simple 20-minute walk once a day would be sufficient as far as an aerobic activity that would actually increase blood flow. It's great for sleep. It's great for anxiety.
So even though this dog may pass germs to me, the dog is doing me a favor by getting me out walking.
If it gets you out walking at 20 minutes a day, is better for you than sitting.
I don't know. Okay, so hydrating, sleeping, getting a little bit of exercise, even just a little bit, is actually a good thing.
Any kind of blood flow where you're increasing your circulation is good for you.
I understand that as we get older, cardio used to be the word. Oh, everybody needs to get their heart rate up, something like strength training they're finding that's really very good for us too, right? For our bones.
They're good for different things. Strength training and weightlifting is better for your bones and obviously increasing muscle mass and strength. Aerobic activity is better for your heart and your vessels. And so the combination of the two together, or mixing it up, is probably best for you in the long term.
I watched a thing on television the other day where they were showing different exercise techniques, and I watched it thinking, that looks suspiciously like floor scrubbing. Oh, that looks suspiciously. It's like, oh, maybe that hard work is a thing to be put back into our daily exercise routine too. All right, so top reasons to only see the doctor when we actually really truly need you. It helps you, be more effective too, is that hydrating, that sleeping, the exercise, even if it's 20 light minutes a day, maybe a little strength training. And then the top reasons we go to the doctor, low back pain, and that's something we can help ourselves too. Like you said, with the core training, or getting that core aspect of our body. And darn it, posture. Another one. Grandma was right. Wash your hands, sit up. All those lectures we heard as kids.
They're not going anywhere. They're going to stay with us for eternity.
You base a whole career on us ignoring our grandmothers. That's terrible. Upper respiratory infections and flus. Washing your hands and taking care of the issues that might bring those germs into your life. Anxiety. That's where also that hydrating, that sleeping, that little bit of exercise. Also, it's not just the apple a day that keeps the doctor away. It's those things too, and that's a tough one because life is pretty stressful anymore, and stupidly so. I mean, I think that you should have a prescription pad that tells people they have permission to turn their phone off for a certain number of hours a day. Now they're telling the sheriff's department is saying, oh, sleep with your cell phone near your bed in case you need to, reach. What? No, because then my mother's going to reach out at 11 o'clock and the phone's right there. Yeah. So I feel like, we need permission to not be on the phone. And then headaches, again, you may be having headaches, but not a reason to not call your doctor because it could be something more. I want to talk very briefly before we go to break. blood pressure. I know that I'm of a certain age where occasionally that blood pressure spikes. I feel like it's very often emotion related. I have a tendency to not breathe because I'm talking so fast. But is this when should we really start being concerned about our blood pressure and the concept of hypertension? At what age does that really become something to start talking to your doc about?
Well, I think, getting a checkup every year or every once in a while is important because you can't feel high blood pressure. And so you really, the
I can identify it, though. I know her phone number.
Yeah.
But you can't feel it.
You can't feel it. And statistically, there's about a third of the population that are walking around with high blood pressure, or we call hypertension, and don't know it.
So it's not just the red face where you go, oh, you have high blood pressure. It's something that you can...
It's actually a formal diagnosis based on having consistently elevated high blood pressure readings.
Wow.
And so the only way you know it is to check it, whether you check it, through the doctor's office, which obviously is nice.
Again, this is a journal, having the cuff and journaling.
Yeah, and you can buy a blood pressure machine for $60, $70 at the pharmacy. Most of the pharmacies now have blood pressure machines that you can just check it there casually when you're there. But I think checking it and seeing that the numbers are within normal limits is really the most important thing, because that's a treatable illness that has devastating consequences of developing potentially heart attacks and strokes if it goes untreated.
We're going to do a whole day about that. You're coming back one day. Again, we're talking with Dr. Michael Farzam here on Dr. Proctor. He owns a company called House Call Dr. Los Angeles. You can find him at housecalldrla.com or email him info@housecalldrla.com. We'll be back after these messages here on your hometown station, AM 1220 KHTS. Hey, AM 1220 KHTS, your hometown station. You're listening to me, T. I'm normally with you Monday through Friday, your drive time personality. But today, every Thursday, noon to 1, I like to sit with members of the medical community and sort of have an informal chat about what's going on with the world of doctors, world of medicine, so that we can become our own best advocates for our health. Not just for ourselves, our loved ones, multi-generational. And the more information we have, the better equipped we are to be able to help the doctors who are now pretty impacted by, one, an aging population. They're calling it the silver tsunami as the baby boomers age. And also the idea that more of the nation has access to health care. That's a good thing, but in some ways, it's also terribly impacting on the doctors, the nurses, and the medical community as more and more people come through those floodgates. So the better equipped we are to go into our doctors and have the conversations for our own well-being, the better it is. Today, I'm talking with Dr. Michael Farzam of House Call Dr. Los Angeles, housecalldrla.com. And we've talked about, being January, I wanted to go over some of the top reasons that people call a doctor or go see a doctor: low back pain, upper respiratory infections and or flu, anxiety, thanks to our hectic new technology-driven lifestyles, headaches. Also, the idea that the top reasons we might have medical things and we're afraid to talk to our docs. Maybe an STD, maybe something as simple as bad breath, which can be a symptom from another larger medical issue. Excess sweating, also something that can be medically taken care of, but might be a sign of something else. And then the idea that interspecies bugs, oh my gosh, doc, you got me nervous now. But all the things we can also do to help ourselves, the top things to stay healthy: hydrating, sleeping, and getting that restorative time for our bodies. A little bit of exercise. I almost forgot that because I didn't want to say it. Can't tell you that's hard for me. And then the idea that we also eat better. Again, I love that you are the doc that comes to the house, but the idea that we can help you help us is critically important. And again, journaling and writing things down so that we don't forget is helpful, yes?
Yeah, definitely.
And give me the number one reason why, maybe more than one reason if you have it, but the number one reason why it's good for you to come to us.
Outside of just saving you from germs, of getting germs in the doctor's office, you get a lot more personalized care and a lot more time in the home as opposed to a typical 7-minute doctor's visit in the office. And
then you also get to see where we live, how we live, factors. You can't lie to the doctor about what you're eating if he can look right in your kitchen.
That's true. It's more personalized.
Yeah. So it's a very good thing. Again, Dr. Michael Farzam of House Call Dr. Los Angeles, thank you so much for being with me today to go go over some of the things that help. Thank you to keep us healthy. So thank you for helping me look over your shoulder at what it is you do every day. Again, this is Dr. Proctor. Can be heard every Thursday from noon to 1. I also invite you to go to hometownstation.com where you can find the podcast of past episodes. If you have questions, info@hometownstation.com. You're listening to AM 1220 KHTS.